Hi, I'm Dr. Patrick Foy. I'm the director of the Tailbone Pain Center online at tailbonedoctor.com. And this is a short video in response to a question about whether the length of the tailbone is correlated to whether somebody does or does not have tailbone pain. In general, what's more important than the actual length of the tailbone is the position of the tailbone and whether the joints are unstable. So there's a lot of variability in terms of how long the tailbone is. In some patients, there's only 3 bones within the coccyx, so 3 individual vertebral bones that are strung together. In some patients there's 4, in some people there's 5. So there's a lot of variability in terms of the number of bones and the overall length of the coccyx in general. But what becomes important is the positioning. So even if it's a relatively, whether it's a relatively long or short tailbone, if it's curved backwards or has a bone spur, a little bit of additional bony material on the lower end, that can be a source of pain when somebody sits, especially when they're sitting leaning back. Or whether the tailbone is long or short overall, if there is instability within the joints, if the ligaments that normally would hold the joints in place are not doing their job of holding the joints in place, of holding one bone in relationship to the next, then again, people can have tailbone pain, especially when they're weight bearing, which for the tailbone or coccyx is when they're sitting, and especially again while they're sitting leaning back. So in general, more important than the actual length of the tailbone is the position of the tailbone, which can be seen on X-rays and MRI, CT scans. And more importantly, because more commonly, it's whether there is instability, whether the joints at the tailbone are not stable, and that can be assessed mainly by doing sitting versus standing X-rays of the tailbone. So we look at the position that the tailbone is in while somebody is standing up, and then we have them sit and lean back in their most painful position, and then we repeat the X-rays and see what position the tailbone has moved into while they're sitting and putting their weight onto the tailbone. So I hope that's helpful just in answering the question of whether the length of the tailbone tends to be correlated with whether somebody does or does not have tailbone pain. If you're looking for more information, certainly you can find me online at www.tailbonedoctor.com, and I wish you all the best. Bye-bye.